let's talk about rates of cancer among millennials and Gen X. I'm Dr. Eleanor Toplinski, board-certified medical oncologist. A study just published in the Lancet reported that millennials and Gen X are at higher risk for 17 different types of cancer compared to older individuals. Now, we have seen prior data telling us that cancer is on the rise in younger adults, and this study continues to add to that growing body of information. One of the questions I get asked all the time is, why is this happening? Why all of a sudden are we seeing these higher rates of cancer in younger people, and what can we do about it? First part is we don't know. There's a lot of research ongoing into this, and lifestyle is certainly thought to play a role, but it's not the only thing. And I think there's a lot of research really trying to figure this out. But in the meantime, what can we do? I think the first and most important thing is we really need to change this narrative that someone is too young to get cancer. Often people's symptoms are maybe being dismissed or put off because of this, you're too young to have cancer. And the studies tell us that that's just not true anymore. And so with rising incidence in younger populations, we really need to make sure that when people are coming in with symptoms that could be cancer, certainly could be something else, but if they could be cancer, that they're getting the appropriate workup and they're not being dismissed or put off. Number two, we really must focus on making sure that younger people are getting their cancer screening. Breast cancer screening, colon cancer screening. In fact, the recommended age for screening for colon cancer for average risk individuals was lowered from 50 to 45 because of a rising incidence of colon cancer in young adults. Lung cancer screening, cervical cancer screening, and so forth. Making sure that people are aware of their individual risk, because a lot of these screening recommendations are for average risk individuals, and if someone is at higher risk, their screening age may be lower or different additional modalities may be added. And lastly, being aware of lifestyle recommendations that can lower cancer risk, and these include smoking cessation, limiting alcohol use, exercising, focusing on eating less processed and ultra-processed foods, more plants, more whole foods in the diet. Now, that's not to say that these lifestyle recommendations eliminate the chance that someone's going to get cancer, because unfortunately they don't, but they can lower the risk, and that is something that we can do. I would love to hear your thoughts, your questions on this topic, because it's something that we all must be paying attention to. Let me know.